Vital signs are the key essential elements within our body. So you have a full set of vital signs, which will be T, P, R, B, P, O2, and then the level of pain. Temperature, pulse, respiration, BP, which is blood pressure, oxygen, and then the pain level. The temperature is really important because our body is in homeostasis, right? It's a balance. So it's a big thermostat. So you don't want to overheat and you don't want to underheat it, right? You want to keep and maintain a very essential balance. If our vital signs are out of whack, then that's some type of indication that there could be disease, infection, or some type of chronic condition that can alter us. So within our temperature, anything that's over 99.9, that's going to put us in a fever. You want to make sure that you give your patient, the nurse will give the Tylenol, acetaminophen. That way it will start to bring that fever down. We do have a gauge. We call this a temporal gauge. You go right through the temporal there, 97.7. If it was 99.9, it would algorithm to red. Okay, a full set of vital signs is going to be TPR, BP, O2, and pain. If the nurse asks you to get vital signs, you say, sure, full set or blood pressure. If she says blood pressure, then you make sure you get blood pressure and heart rate. They're a couple, they rock together. That's how they do. If she says, just get the full set of vital signs, you want to make sure you put into this order, TPR, BP, O2, and then the pain level, okay? The pulse, the normal range is 60 to 100 BPM, beats per minute. So that's 60 to 100 beats per minute. Anything below 60, that's going to be bradycardia. Brady is slow. Cardia, heart. Okay, slow heart rhythm, slow heart beat. If it's above 100, that is tachycardia, heart. So that's the heart fast, okay? So bradycardia and tachycardia. Respiration is 12 to 20, okay? 12 to 20, that's the breathing. The inhale, exhale, 1. Inhale, exhale, 2. Okay, that's the respiration rate. If you have your blood pressure, you have your systolic, SCI, S, top number, and diastolic, D, down, bottom number. Okay, so 120 over 80 would be the normal range. Anything over 120 would start to get into the pre-hypertension, but make sure you don't diagnose. You stay within your scope of practice, whether you're a nurse or a CNA, okay? If it's below 100, the systolic is below 100, then that means that the patient can be in what we call hypotension, okay? Above 130-ish, that's hypertension, hyper, excessive, high, okay? O2 is your oxygen level. If your patient is on oxygen, then they would be on liters and measurements. That's 1 liter or 2 liters, 3 liters, or so forth. The doctor will prescribe those orders. As a CNA, what's in your scope of practice is not dialing the gauge, but observing and seeing how many liters your resident is on. If they're supposed to be on 2 liters and you go into the room and you see that they're on 3 liters, then you want to do what? Notify the nurse and let the nurse know. If you receive a patient and the patient is on oxygen, it's up to you to verify how much oxygen that they are on. That way you can monitor. Your patients who have oxygen, you always want to check and see what their pulse oximeter is. It'll tell you on this little gauge their O2 sats, oxygenate the oxygen, as well as their pulse, their heart rate on this little gadget here, okay? Your pain level, 0 through 10 or 1 through 10. 10 is at the highest, 0 is at the lowest. So you ask your patient, what level of pain are you having? If they say 10, then it would be a 10 out of 10. Now, just keep in mind, if your patient is at a 10 out of 10 and they say, oh, I'm at a 10, and you're looking at them, you're like, well, the book says that they should be crying at this point, but you're not crying. So I'm going to give you about a 5. You don't want to do that because maybe the patient is at chronic pain and they live at a 10 and they know how to just live and push through their pain. What if it's a cultural thing? What if they were taught not to show their pain? Maybe they have a high tolerance. So you always want to just gauge what level of pain the patient is at and ask them, can you please point to where the pain is? They point to the knee, then you put left knee. If they point to the head, you put headache, right? And then have them describe, is it dull? Is it throbbing? Is it pressure? Is it sharp? Is it shooting, right? Is it throbbing? Is it aching? What type of pain? And then you let the nurse know. If you're a CNA, best hack to do, write that on the piece of paper, write your initials, make sure you put the time, your title, the patient's room number, and the level of pain, where the pain is, and then go by the nurse's station and put it flat down on the medication cart. You don't have to make it a big old drawn out thing. The nurse is busy. She will get to it when she has time to get to it. All right. So thank you so much for this little crash course on the vital signs. Learning with Nurse Candy. Stay tuned for more. Bye-bye for now.